Tay Sachs disease is a fatal genetic lipid storage disorder in which harmful quantities of a fatty substance called ganglioside build up in tissues and nerve cells in the brain. The disease is named after the British ophthalmologist Warren Tay, who first described the red spot on the retina of the eye in 1881, and the American urologist Bernard Sachs in Mount Sinai Hospital, New York, who described the cellular changes of Tay Sachs and noted an increased prevalence in Eastern European Jewish population in 1887. There are three forms of Tay Sachs disease categorized by the types of symptoms and the age when the symptoms first appear. The most common forms appear when the child is 3 to 6 months old, with the disease progressing rapidly to death by ages 4 or 5. At birth, the infant appears healthy and develops normally for the first few months of life, but as the buildup of ganglioside GM2 begins to affect nerves, symptoms appear. This Tay Sachs disease is caused by the absence of a vital enzyme called hexosamicide A, or HexA. Without HexA, a fatty substance or lipid called GM2 ganglioside accumulates abnormally in cells, especially in the nerve cells of the brain. This ongoing accumulation causes progressive damage to the cells. By the time the child with Tay Sachs disease is 3 or 4 years old, the nervous system is so badly affected that life itself cannot be supported. Even with the best of care, all children with classical Tay Sachs disease die early in childhood, usually by the age of 5. By about 2 years of age, most children experience recurrent seizures and diminishing mental functions. The infant gradually regresses, losing skills one by one, and is eventually unable to crawl, turn over, sit, or reach out. Other symptoms include increasing loss of coordination, progressive inability to swallow, and breathing difficulties. Eventually, the child becomes blind, mentally retarded, paralyzed, and non-responsive to his or her environment. Presently, there is no treatment for Tay Sachs disease. Anticonvulsant medicine may initially control seizures. Other supportive treatment includes proper nutrition and hydration techniques to keep the airway open. There is no cure for Tay Sachs disease, only comfort to help the patient. Children may eventually need a feeding tube to be sustained.